Welcome to Rational Alchemy, though we should probably be called Rational Single Payer Health System. What you say, not again? Yes, again. And it's really important that you watch this video because Sarah and Bill, my two guests today, are going to explain why. Let's do some introductions. Sarah.
Nigel, thanks so much for having us. I'm Sara Wright, and we're with Colorado. This is Bill Semple. We're with Colorado for Universal Healthcare. And our mission is simpler, guaranteed, quality healthcare for all for life.
Perfect. Bill.
Yeah, Bill Semple, and I'm the board chair of Colorado for Universal Healthcare. And it's that mission statement that Sarah said is what keeps me going.
Absolutely. I can fully understand that. So let's get into this a little bit. I did do some notes here on the National Health Service in Great Britain. Why is it so important that we really desperately do need this kind of system and get rid of the insurance companies, et cetera, et cetera, et cetera? Bill, take the question.
I'll start with it. And we've got a healthcare system where the Affordable Care Act has made some significant changes and helped some people, but we spend way too much money, and more people are underinsured. So we really don't know what our healthcare expenses are going to be. The majority of bankruptcies in this country are due to healthcare. The majority of debt is due to medical expenses. We don't have to do that.
Oh, I agree.
Americans
Totally.
are more afraid of the cost of getting sick than they are of actual illness.
Yeah.
And folks I know are won't take an ambulance. You know, they won't go get health care. And when you're hurt or injured, and everybody is vulnerable in these human bodies. You know, I work out, I feel invulnerable some days, and then I get a little injury, and I know we've all had that experience of suddenly needing help from a healthcare provider. That's why people love nurses. You know, all of a sudden you're in a car accident and you're terrified and you're hurt and you need help. And you know, what's the first thing people hear in the hospital? Emergency room, you know, well, where's your insurance card?
Right.
And, you know, they're all focused on getting paid. And so I just want people to take time to really imagine what it would be like to have a healthcare system in this country that was focused on all of us being as healthy as possible and our communities being as healthy as possible.
Right. One of the concepts of the National Health Service when they were first looking at this back in 47, 48 was this very important line, a health service based on clinical need, not the ability to pay.
Well, and that is the one thing that our healthcare system in the U.S. does very well. It makes healthcare very expensive.
Yes.
And it makes a few people very wealthy. It does that very well. And unfortunately, the rest of us end up clinging to whatever scraps we can get from it. But we can do that. We can do much better.
Right. Plus, I don't think people realize that over here that with health insurance, it's a tiered system. And depending on where your health insurance sits in the tier will depend on what sort of coverage you really have.
Yeah, they say people, you know, they love their health insurance till they need it. And unfortunately, the health insurance companies make money the more health care they deny.
Correct.
And so the incentives are just wrong. Like, so we already spend public dollars in this country enough to have a universal healthcare system. And then we spend a bunch privately on top of it.
Yes.
And so we can do better. We should do better. It's really important. I think that people have stopped believing that it's possible, but we do public good in this country all the time. We decided to have the internet, and we did that. We decided that we want roads. We did that. And in fact, it's our public dollars that fund universities to research and develop medications. Right. It's not the pharmaceutical companies, it's our tax dollars.
Yes.
And then they take the money and charge us $1 gazillion for it. And they don't care who dies because they just want their extra yachts, you know?
Absolutely.
And so it's time to to get the middle people out that are just leeching off the system for profit alone and take back our health care in this country.
The big drug companies, if they really wanted to spend a lot of money on research, they could. Stop advertising on television for drugs that no one knows what they do. What am I meant to do? Run to the doctor and say, should I be taking this?
Ask your doctor if premature death is right for you.
Absolutely. I'm going to make a note of that one, Bill.
Okay. One of the things, over the last 40 years, the number of physicians in our country has about doubled.
Yes.
With the population, that sounds about right. The number of health administrators has risen by a factor of 30.
Wow.
And that speaks to the problem that we have, that we need to simplify how we pay for care so that the focus can be on our care.
It's just wasting money, isn't it? Our money.
Well, they've built a maze.
Depends who you're talking to, but yes.
Yes.
They've built a maze between us and our doctors where they can say no, and the doctor has to fight to get you approved for the care that they were trained.
Correct.
But then also for you to try to get them to pay your doctor. And they made it complicated on purpose because they know that if you have cancer, your wife has cancer, your kid has leukemia, you're not going to have the time and energy to fight the maze, to make the 20 phone calls, to fight for your rights, and they know they're going to win. So I don't know, I'm not sure why this isn't a no-brainer for us other than we've been basically convinced to fight for each other. That like, why am I going to pay for someone else's health care? Like I'm going to lose what I have. It's like, well, why are you going to pay for someone else's road? Like, because
that's right.
Because we all drive on the road and it benefits all of us to have a road.
Let's talk a little bit about what you're actually trying to do to solve this problem, what you're hoping to accomplish here in Colorado.
We had legislation about 4 years ago that compared how we pay for health care now to a universal multi-payer system and a single system. And that showed that actually we can cover everyone, spend less money, have better health care, and even boost our economy. But there's only one way to do it, and that's by having a single publicly funded, privately delivered way to pay for health care. The last couple of years in the legislature, we've worked in supporting a bill that has looked to analyze what a single payer system in Colorado would look like.
Okay.
And how, could it work? I mean, because we really don't know. Can a single state do it? We don't know that for sure. And so we need to look at the feasibility, the fundamental feasibility of it. How you would fund it. Could long-term care be included in that? I mean, that's how we impoverish a lot of people in this country and in our state. So we need to look at that because there would be real savings by having people get care at home.
Yes.
So they wouldn't have to go to the ER or
whatever.
or a nursing home. Whatever. So there are a lot of questions like that need to be addressed, and so that's one of the things that we're doing is looking to analyze what a single system in Colorado would look like.
Okay.
It's actually Representative Karen McCormick of Longmont and Andrew Bazenecker are the two representative prime sponsors, and the bill is called the Analysis of a Universal Healthcare Payment System. And there's also two prime sponsors in the Senate, Janice Marchman and Senator Sonia Hawkes Lewis, who used to be a pharmacist. And it's looking at 10 essential benefits to a universal healthcare system and how it would impact all these different stakeholders, every socioeconomic group, small business, large business, the hospitals, even the pharmacy benefit managers. Bless their hearts. I'm just kidding. Just how it would work, who it would impact, and how there's a racial equity impact analysis, because right now there's really problems with different outcomes depending on the color of your skin in our healthcare system in the U.S. and in Colorado. We're no different. We could be, right?
Yes.
So it's looking at what's possible. We envision everyone having comprehensive health care that includes dental, hearing, vision, and mental health. We envision healthcare decisions being made again by patients and their providers. And there's much more to these 10 essentials, but we want to know if what we imagine and envision is possible, how it's possible. Because honestly, everyone who's working hard to make this happen actually only wants it to happen if it would actually really work for all the people in Colorado, the rural communities, the rural hospitals. Like, we don't have an agenda if it's not good for everyone.
That's correct. Talking of rural hospitals, would they benefit from this, or would it hurt them?
Oh, well, right now, we're losing hundreds of hospitals in rural parts of the country.
Oh, really?
It's really hard to make a go of it. So this could be a lifeline for the rural hospitals in Colorado.
Those Flight for Lives, when I was a kid, the helicopters, like if you fall and you break several bones in the mountains, you know, those Flight for Lives used to be part of regular healthcare. Now, that's an extra private, $60,000 and up bill for people. I mean, and it's just, when you're in that vulnerable position and you're scared, it's sometimes life or death.
Yes.
And when we're seeing healthcare as a public good, rather than something that we each individually need, adequately funding rural hospitals makes sense. Funding primary and preventive care, that makes sense.
Yes.
Because that's good health care. And right now we have disease management that focuses on specialty care. It makes people money, but it's not as good health care that we need.
Right. And, we talk here of good health care. It's really important that everyone is treated equally to start with. But let me add a little subject to that, National Health Service. People seem to be under the impression that you cannot get private health insurance in Great Britain because of the National Health Service. Untrue. You can. If you're very, very wealthy and you want to get private insurance as well to go to a private hospital, you can get it. And the interesting thing is when I looked up the cost, typically it's about $300 per month per person. So even then, even privately in the UK, it's still a damn sight cheaper than it's going to be over here for your out-of-pocket expense.
I think people don't realize what it could be like to live with universal health care. And, what was it like for your aging mom?
Mum passed away when she was 94, but when she was 87, she had a hip replacement. Unfortunately, when she was 87, 88, it broke. And she had to get to Lymington, which is about 20 to 25 miles away from Ringwood, where we lived. Ambulance turns up at 11 o'clock in the morning. Two gentlemen get out, they wheel the trolley in, they put Mum on the trolley, they take her out to the ambulance, they take her down to Lymington. She gets to Lymington, first thing that happens is have you eaten Mrs. Abe's? Oh, a sandwich would be nice. They'd bring her a sandwich. She'd then go and have her x-rays or scans, whatever it was they were doing that day. Finish, back in the ambulance, taken home, brought into the house, put back in a chair. Cost, nothing to Mum. It was all covered.
And that's what we're looking for, is a prepaid system.
And there was one other thing that I think is also important. Mum couldn't walk. She could stand up and twist round to use the toilet, but she could not actually walk 5 or 6 steps. Very, very difficult. Calls the surgery in the morning, doctor is visiting at 1 o'clock in the afternoon, still doing home visits. Ask for a home visit over here and you are going to get laughed away. But you have to understand that some people, it's a requirement.
And public community-centered health is done really well in some of the countries with universal health care, like the Costa Rica, and there's a real opportunity there to meet people where they are, to meet them with what they need, and when everyone in the community is healthy, we're all stronger, fewer sick days. The person that's fixing your car or giving you breakfast at the restaurant, that they're well. I mean, that's a good thing, right?
That's a good thing.
We like that. We like it when the community is well.
I agree.
Senator Paul Wellstone had a good saying back in the day, and that was that we all do better when we all do better.
And that's true.
And that's true in a lot of ways, but especially in healthcare. And so that's why
Absolutely.
seeing healthcare as a public good really just makes good sense.
Yes.
People
yes.
are precious, and we're worth investing in, each and every one of us.
Oh, absolutely. Absolutely. I don't think people really realize that healthcare affects the society rather than the individual.
Yes.
Now, obviously, it does affect the individual,
Yes,
but
exactly.
it really is looking after the whole of society that's important. It's like vaccinations. Don't get me going on vaccinations.
Okay, we won't.
If I was in power, I would enforce vaccinations. Look at the problem we're having with mumps. Mumps is now making a comeback. Polio has been discovered again. I thought that died out 61, 62. No, it's coming back.
Well, it's an interesting issue that people are afraid that a single-payer system would be government-controlled healthcare. And that's actually not what we're talking about.
That's correct.
Yeah.
We're talking about, because right now we have insurance company-controlled
Controlled
healthcare.
Healthcare.
That's who's deciding
And-
who gets what. Yeah.
And so can you choose who your provider is? Yeah, if you want to pay out of pocket. But with a single system, we would all be free to choose the provider that we want. So there would be more competition among providers than now. Now we really limit competition.
Yes.
And that should be un-American.
Yeah, it's really a publicly funded, but as you said, privately delivered.
Talking of the funding, how would this be, in your ideas, how would this be funded?
Well, that's part of what the bill's going to determine.
Okay.
But it'll be based on premiums and the ability to pay, and then it's an enterprise through. I have the bill in front.
There'd be an enterprise that would be the single entity that would pay for health care. And so it'd be paid, you would pay in based on income. Mm-hmm. So a few people would pay more than they are now for premiums, but they would be guaranteed health care. And most people over their lifespan, they
Yes.
start off not making too much money, they would be covered. They make a lot of money, they would probably be paying a little bit more, but maybe only 10, 15, 20% of people would be paying more. That's one of the things that we want the study to analyze.
But it's also important
be
is they may
guaranteed.
be paying a little more, but they're now getting full coverage.
Absolutely.
And guaranteed.
Yeah, and guaranteed. There is no arguments about, well, our policy doesn't cover that.
Yeah,
Because there is no policy.
right. The policy is keep people healthy
The
and
policy
provide
is
them the care they need.
it's all covered.
Yeah, it's
And I
take
think-
care of people. That's the
And
policy.
I think people need to understand that as well, because
Yeah.
I was amazed. 21 million Americans are uninsured.
And more are underinsured.
And that's not talking about the underinsured.
And so what we're talking about is a prepaid system, basically.
Yes.
So that you pay your premium, you
Yeah,
pay it
etc.
based on your income. But then when you need health care, the question isn't how can you pay and how much is it going to be, God forbid. It's what care do you need and what care do you not need?
Right.
That would be the question at the time of service.
And when it's people's employers, first of all, I mean, imagine if you're an employer not having to figure out each plan each
Yeah.
year, that whole nightmare. But also American, employees are put at a competitive disadvantage because they have to pay for healthcare. It's a huge expense for counties and
Huge.
cities and school
Yes.
districts to pay for health insurance. And those costs go up every year. They go up for the teachers. They go up for the firefighters and the
That's
county
right.
employees and everyone else, and for the employer. And it covers less and less. And, then like if they're competing against another country, that those people are all just covered. Imagine if everyone you wanted to hire already had health insurance.
Right.
Right? So and then there's this whole job lock where people are stuck in jobs they hate and they can't move around because
Right.
they need the insurance. We've talked to people who have stayed in abusive relationships for the health insurance because they had a sick child. There's also people that haven't gotten married because of health care, and I don't know the ins and outs of that, but it's literally controlling people's lives.
Right.
It's just messed up.
I, of course, am very pro-National Health Service because of my open heart surgery when I was 12 years
Yeah.
old. Yes. I spent 50% of my childhood in hospital, according to Mum. and she kept quite a note of this, and had open heart surgery in 1963. My life expectancy at the time was 18. If I'd have been born in America, you'd now be talking to the ghost of Nigel. Because back then, in 63, open heart surgery was still classified as experimental.
Wow.
Which meant that no insurance company would touch it.
When you do pass, hopefully a long time from now, will you come back and do a show as the ghost of Nigel? 'Cause I wanna be on that show too,
Absolutely.
okay?
I could think of no one better to haunt than you, Sarah. Anyway, before we finish, how do people get involved in this?
Yes, well, they can go to our website, which is couniversalhealth.org, and there's also a link tree that has a link to tons of different ways to get involved. That's link tr.ee/CO4UHC. So the other thing is watch for us on Colorado Gives, because we are, working to win simpler, guaranteed quality health care for all for life in Colorado and the U.S., and we'll take whichever way it comes first.
Absolutely. Bill, any final thoughts?
Well, I'll just say that again. Simpler, guaranteed health care for all and for life.
If we can change a few minds, that's going to be the hard part, unfortunately.
It is, because it's just human nature to hold on to what you've got.
Yes.
Especially when you're scared. And people are scared about healthy, like Sarah said. People are more afraid of paying for health care than for being sick. That's backwards.
Sarah, final word.
The thing to remember is when people are teaching you that this is a bad idea, and you're hearing it's a bad idea, think about who is paying for those messages, because the people who are building yachts off of the healthcare dollars that aren't taking care of Americans, they have so much money to convince Americans that single-payer universal healthcare is a bad idea. Just don't believe everything on TV.
Oh.
Don't always ask your doctor
Not when
about
it comes to this, especially, because you'll get nothing but, well, I'm going to say it, bullshit. That's the only way to sum it up, really.
That's one good summary. Yep.
And I have heard an awful lot of it on TV talking about healthcare in this country.
Yes.
We don't have the best healthcare system in the world. We don't.
We die younger.
We have some great professionals who
We do.
practice, and we have some incredible technology, but the whole system should be about taking care of people and making us healthy. That should be its purpose, not making profit for a few.
That's correct. And as you said when we were sitting before the show, we are the only industrialized nation that does not have a universal healthcare system. That should tell you something. It really, really should. Thank you so much for listening to the show today. As I said, yes, this is a topic that I do get a little expressive about. So I think it's so important. You can get good health care without being ripped off every month by the insurance companies. You really, really can. I'm Nigel Aves, your host, signing off. This is the Captain's Lounge Studios. Adios, and I will see you in the very near future. Thank you.
The Colorado Foundation for Universal Healthcare champions a single-payer universal healthcare system, such as improved Medicare for all, the simplest, most cost-effective way to care for everyone. Sometimes states must shine as beacons of innovation. Colorado could lead the way. We're a leading proponent of universal healthcare in Colorado. We also work for National Improved Medicare for all. Everyone deserves healthcare. We at Colorado Foundation for Universal Healthcare will continue our work until every single human has the healthcare they need when they need it.